You can actually deliver normal after a cesarean section, but we usually look at several factors. One of the factors is what was the reason for the first CS? If the first CS was done because of a problem that is recurrent, let's say you had what we call cephalopelvic disproportion, meaning your pelvis maybe is not adequate to be able to undergo labor and delivery of a baby, then we'll advise you not to try a normal delivery. Or maybe you had a deformity of the birth canal, we'll advise you not to have a normal delivery. But if the reason they did the cesarean section is not something that is recurrent, let's say maybe the baby had what you call fetal distress, or maybe you bled, that's why you are taken to theater, you can be allowed to go for a vaginal delivery. But several factors have to be considered. The period is very important. The period from the time the cesarean section was done, the period when you deliver normal. So if you take a shorter interpregnancy period, less than 18 months from CS to vaginal delivery, the risk of rupture is slightly higher. And when I say rupture is, when you deliver vaginal after cesarean section, the main risk is usually rupture of the uterus. That is the scar on the uterus, not the skin or the muscle scar. It is the scar on the uterus. During labor, there's that stress on the scar. And for some women, because of several factors, they can get a rupture. So that scar opens before delivery. The risk is more so to the woman because of bleeding. There's a lot of bleeding when it ruptures. And most of the time, if action is not taken very fast, you actually lose the baby. So there are several factors we look at that might tell us not to try a vaginal delivery, like the interpregnancy period. The weight of the baby is very important. If your baby is big, 3.8 getting to 4 kg, 4.5 kilogram, we'll advise you not to try vaginal delivery after the cesarean section. The hospital where you deliver is very important. The environment, because if you're delivering vaginal delivery, it has to be in a hospital that has a theater, available personnel to operate on you in case we pick that there's a risk of rupture. So during labor, you can rupture. So what is the time period between rupture and the time you're taken to theater, so that we don't get a bad outcome, like the mother bleeding and losing the mother or losing the baby? So that time factor is also very important. The woman should be ready to deliver vaginally after a cesarean section. So to answer directly, yes, it's possible, but there are several factors that we look into before deciding whether you're going for a vaginal delivery after a cesarean section has